Congratulations on becoming a mom. So, throughout the whole prenatal journey, women are very motivated to come in and get care for their bodies because we want to optimize the health of our babies and the developing baby, and we want to set the stage for success. But it is so important to remember that even though the baby has now arrived, your body has experienced numerous physiological and hormonal transformations in preparing for the baby's arrival. But now that the baby has arrived, there's a whole different series of changes occurring as your body is coming back into its pre pregnancy condition in some regards. And it's also important to recognize that postpartum can actually last for years, right? So even though your child might be in elementary school, you might still be in the postpartum phase because it can be a really, really challenging balancing act for the body to go through all the different changes that it has to kind of undo or redo, and all the things that take place in this phase of our lives. So, chiropractic care can really assist in addressing these various postpartum issues that can arise during this transitional phase. And it is so important to recognize that it is still just as important to take care of your body as it was during this whole prenatal journey. But one of the things that tends to arise very commonly, especially in the initial months after your baby arrives, is this whole idea of nursing mother's neck. And we have a whole video talking about it in more detail. But generally, during the prenatal journey, women are often coming in with low back or mid back, or we talk about how you might be experiencing heartburn or digestive challenges. So a lot of it tends to be focused on symptoms relating to the mid back, low back, tailbone, all of those areas. But after the baby arrives, because there's a lot more holding and looking down and not wanting to move as the baby is falling asleep and just enjoying that time, or hopefully enjoying that time, there can be a lot more stress put on the mom's neck and upper back. So there's this general shift in where we notice our musculoskeletal complaints. And so rather than just trying to ignore it or just hoping that sleeping it off will help, which it may, but again, trying to address the underlying cause and not just hoping that it will fix itself, because we want to make sure that the body is adapting and compensating appropriately so that we don't just set up the stage for even more challenges going forward. One of the other things to really pay attention to is making sure that you're getting enough zinc. So zinc deficiencies are super, super common in premature infants and children with malabsorption syndromes, but it is actually believed that the entire human race is borderline zinc deficient. So the signs of zinc deficiency could be things like diarrhea, growth failure, alopecia, irritability, anorexia, and it's also implicated in skin lesions such as diaper rash and candida manifestations. So these implications could also indicate that there's a fatty acid deficiency or perhaps an excessive sugar intake. So typically when individuals are not digesting fats or lipids appropriately, are also the ones who tend to consume excess sugar, right? The sugar cravings. So if you're noticing that you're tending to reach for the sugar a little bit more than you did previously, you can find a link to one of my favorite zinc supplements below. But along with talking about digestion or absorption, the other thing I want to bring up again is postpartum depression. So we talked a little bit about this in one of the previous trimesters where we talk about the link between our gut health and then our mental health, right? There, whether or not you're pregnant, whether or not you just had a baby, this is well researched and documented connection. And postpartum depression doesn't have to be, severe stages of depression. It could even be just not wanting to engage or not being able to find joy in this phase. And I get it. It can be really challenging and stressful. But if you find yourself in a space where you just want to, you're having challenges coming out of it, looking at your digestion can actually be a really significant aspect or key to unlocking what is going on. So looking at, are you getting the appropriate nutrients in for sure in what you're taking in, but also looking at, are you digesting those foods appropriately? So if you'd like further help with this, or if you want to get more information, I'd love for you to check out the course with the link below for Move Well, Eat Well, Live Well, where we talk about how to take action on all this different information and how to make sense of the different information that you might be receiving, especially at this phase in your prenatal journey. So I'd love for you to check it out and hear what you think. Thanks for watching. I'll see you next week.